we want to hear from all the exciting things that are happening in Illinois. And Illinois, as many of you probably know, has undertaken this extremely ambitious notion of bringing together in a consolidated framework 7 large agencies and looking at how this entire concept of interoperability and interoptimability can be put in place across really the bulk of the human service agencies in one state. And we're very fortunate today to have the CIO from Illinois to lead off this discussion and talk about some of the initiatives that he and his team are undertaking in this grant that they've been working on from ACF. And we're delighted to have Sean with us today to kick this off. So I'll turn it over to you.
Good morning. My name is Sean Vinck. I'm the CIO for the state of Illinois. With me are 2 of my colleagues, Kathleen Monahan, who is the director of our Framework project, and Ivan Handler, who is the director of our Health Information Exchange. So we're here to talk about Illinois' Framework project, and let me see if I can get to the next slide. There we go. Framework, as was mentioned, is a 7-agency, interagency collaborative. It's composed of all of the agencies that we think of as comprising our healthcare and human services enterprise architecture. So that's public health, our Medicaid agency, Department of Human Services. All told, they encompass over 100 programs, federally and state funded, related to healthcare and human services. The observation that we have, or I guess maybe this is probably more specific to me, but I think it's pretty commonly shared throughout our administration, is that as we move forward, Illinois' biggest problem is budgetary. So we have 40% of our budget goes to 2 purposes: Medicaid, and pensions. Those 2 expenses grow mandatorily at 8.5% per year. Revenues in a good year grow at about 3.5%. We have a 2% per year annual funding, spending cap, which means that the available resources from the state's taxpayers for every other purpose besides Medicaid and pensions will constrict year after year. And that's even though we have raised taxes from 3 to 5% on individuals, getting in $6 billion new dollars. So the available money for human services, for public safety, for every other purpose of state government, education, et cetera, is going to go down. So we have to do more with less, and that's true even if we've raised taxes. How do we do that? Well, everybody thinks, I think, on some level that technology is a way to resolve the gap between the demand for services and what the available resources are. The observation that I think I have, and perhaps some of my colleagues share as well, though, is that the way that we have devised to deliver these services, the 7-agency architecture and all of the silos and bureaucracy that entails, is actually exacerbating the problem to a significant degree. So what Framework is about is an attempt to use technology and to use the scarcity of our resources to forge a 7-agency intergovernmental collaborative that will hopefully leverage technology to bridge the inter-silo gaps and transactional inefficiencies to deliver customer-centric human services healthcare programs to the citizens of the people of Illinois in the most economically efficient and technologically optimized way possible. So to kind of solemnize this collaborative, we browbeat each of the 7 agencies into signing an intergovernmental agreement. That's not true. They all loved it. But I'm making a joke, but it kind of, I think, obscures what is really a significant point, which is that you have a lot of good people in your enterprise architecture. This is a point that was made earlier. I think this was made yesterday, too. Really, the success of any organization or any leader of an organization is dependent upon how they have behaved relative to what the definition of their job is. So in our state, like in every state in America, you have statutes, rules, and regulations that devise agency structures and define the rules and responsibilities for the management of those agencies. And the people in the bureaucracy feel a tremendous overpowering impetus to perform well to the standards that are set forth in law. as they should. But it is the accumulation of those duties, and it is the faithful adherence to those requirements that oftentimes, taken together, is the source of a lot of the transactional and bureaucratic problems that are costing us too much money and delivering suboptimal services. So the reason I think it was, as one person said, ambitious, and I think still quite a work in progress, to get all of these agency directors to agree in principle that what unites them, what it is that they deliver to the body politic is more important than the silos that segregate them. So that is a threat to them because it requires them perhaps to subordinate what they perceive to be a key objective to the interest of the common whole. So we really see the technology as paving the way for the erosion and hopefully the destruction of all of the barriers, to the extent that the barriers are a prior impediment to efficient and effective service. We list some of the goals of the framework project. We want to have an enterprise-wide governance for all of the investments that Illinois is making in healthcare and human services. This is a really important point. With the passage of the Affordable Care Act, like all of you, we're doing Medicaid expansion. We have a health information exchange. We have a health insurance exchange project that's kind of in limbo. The legislature in the state is not as enthusiastic as the governor is about implementation of the Affordable Care Act, so more on that later. But we have a tremendous amount of money and resources going into largely federally funded or federally matched enterprise technology projects. The danger with our 7-agency structure is that these all kind of function in silos. So what Framework is an attempt to do is to have some method of coordinating all of those resources and to provide tangible assistance to them. So we want to maximally leverage those federal investments, ensure that we're building a usable architecture that can be shared by the entire enterprise, and that we're promoting the collaboration that we think is essential. How do we fund it? I think this is actually something that's a really important point, and I'll try to be brief. I think that capital in a public enterprise is extremely beneficial and extremely distorting. And I think one of the best attributes of the Framework project is that the state has kind of put its own money where its mouth is. We're not simply relying on federal funds. Illinois issued bonds last year to the tune of about $53 million for technology purposes, and so the state has made a commitment of several $1 million to provide the seed money from its own proceeds to fund framework planning and implementation activities. That kind of got the project off the ground. So I think it's very telling. I think it's important that the state share in the actual cost of this. In the intergovernmental agreement that the 7 agencies have signed, we have kind of allocated shares. So it's kind of a utility cost-based rate-making structure. So just as the state is making an investment, we're requiring these agencies to put money into the collective pool in proportion to what their utilization will be. And then we are applying for federal match. We have a match rate of about 42% right now over the aggregate, but we plan to do an enterprise APD with our friends in the federal government, and with any luck, that will be raised to 90% going forward. We have not an ancillary project, but a parallel project, the Framework Governance Project. That project is being funded by a grant that we received from ACF to the tune of $1.25 million. That's studying optimal best practices and trying to think about the architectural and structural things in terms of management and bureaucratic organization for how to create environmental conditions that are most conducive to the kinds of behaviors and systems development that we're talking about. And we are looking to leverage that for purposes that we think are parallel to the core mission of the framework. And I think that concludes my portion of it, Kathleen. Thank you.
Thanks, Sean. Oh, thank you. Good morning, everyone. I'm Kathleen Monahan. I'm the director of the Illinois Framework, and I'm going to talk a little bit about our planning project and the governance grant. Let's see. We are creating an enterprise view in Illinois. We have an Illinois Health and Human Services business architecture that's being created. And the way the framework works right now, well, it's a planning project currently. That's really the most important thing to keep in mind. We are still in a planning phase. And among those 7 agencies, there are over 60 programs that are going to be part of our enterprise view. Right now, we're doing a scan of those 60-plus programs and identifying core business processes that can leverage what's already being built for the Affordable Care Act. So we're looking at the Health Information Exchange, the Integrated Eligibility System, the MMIS upgrade that we're about to do, and we're trying to see what are they building already that some of these other programs that aren't part of the ACA can leverage. So we're going to take a look at that, and our first step is an as-is/to-be, where we can create some opportunities immediately among those programs that can leverage that. Then further down the road, we're going to dive deeper into those programs and develop a further architecture for the state. So this entire process and these 7 agencies are governed by an intergovernmental agreement, as Sean mentioned. We have an executive steering committee for the framework, and not only is it chaired by Sean Vinck, but the governor's office supports this executive steering committee and convenes the executive steering committee. I can tell you, though, that when I met with our director of our Medicaid agency to talk about just an update on the framework and to tell her about the governance grant that we had just gotten, she turned to me and said, you know, this is really the hardest part. And she's right. This is the most challenging part, to get these agency directors to come together with people like Ivan, with the people that are developing these Affordable Care Act systems, and to talk about the future and to start agreeing on some of the policies and financial decisions that they're going to be making down the road. So we've developed a very elegant governance structure, which I'll show you in a minute. And hopefully, in a year from now, I'll be back with dirty hands and a revised structure based on the work that we will have done in the coming year to make these decisions and to operationalize this structure that we're putting into place. Our grant, our interoperability grant from ACF, is meant specifically to do research on governance best practices. As part of that research, we interviewed a few people in this room, and we're developing, we have developed some products already. One of them is called Attributes of Good Governance that some of you might have seen already. And we are going to take the information that we've learned and hopefully apply it to the framework so that we in Illinois are following the best practices that we are researching. So this is a little picture of our governance structure. This isn't an organizational chart. It's the way we think decisions will be made. So the executive steering committee up at the top is these agency directors, and we hope that we can get them to agree to the Linda Gibbs model of principles only in the room, because we'll be able to show them this chart and say, look, all your deputies and chiefs of staff and CIOs can all work on that operational committee, and you guys can just come together and make the big decisions. I'd like to point out that we already have a legal, privacy, and confidentiality subcommittee planned, and part of our work has been that we have already met with the general counsel of each of the 7 agencies to tell them what's going on, to hopefully get their buy-in. Richard, would you say you've got their buy-in? Yeah. And so that we've got them thinking already about how they can help us work together, how they can help their agency directors think about information that can be shared appropriately rather than information that they don't want to share. So, like I said, I hope we come back in a year with a slightly revised chart that's only revised because of the hard work that our executive directors of our agencies have been doing. One more thing. We in Illinois are developing an enterprise APD. And we've had some discussions with both Kentucky and Vermont about their enterprise APD plans. And I think Vermont even submitted one. Ours is going to be quite comprehensive. We plan to basically be an umbrella or a vision for the feds into all of the work that's going on within these agencies and within the ACA. So one of the things we have to do is find all those APDs out there that we don't even know exist in some of these human service agencies. For instance, our WIC program has a couple that we didn't know about. We need to identify them, we need to know what they're doing, but we're not going to be recreating their APDs. We're just going to show the feds that we know what we're doing in Illinois and that we are all talking to each other and that we want to have an enterprise approach. And then we're also going to be taking the information from our scan of all these programs and show the feds how whatever programs fit the bill can leverage the Medicaid build. And so we think that based on what they've requested from us, we should be able to really bump up our federal match. We're hoping at close to 90%. And this was driven by a request from Fed CMS. We've had meetings with our region as well. Our region is, I would say, a little farther behind than the feds at the national level in terms of their understanding of the enterprise APD, but they liked our approach, and basically we're getting the message from the feds: ask us for as much as you can and let us say no, as opposed to them limiting us. They are not limiting us. They're saying, come back and ask for whatever you can plausibly ask for. So this is one of the things that I know a lot of states are thinking about, and we are happy to share with any state, any county, the work that we're doing on our enterprise APD. We're happy to keep you all informed as we move along. We think we're going to submit it sometime in September, and so we might know something towards the end of the year. And with that, I'm going to turn it over to Ivan Handler.
Thanks, Kathleen. Good morning, everyone. I'm the Chief Technology Officer. I'm not the director of our HI. I just want to make it clear. And actually, we're kind of split. Our Health Information Exchange is kind of now split between a state side, which we call the Office of Health Information Technology, and a separate organization, which is the Illinois Health Information Exchange Authority, which has been created in statute and gives us the ability to have a public-private partnership, because one of our goals is to engage not just state agencies, but all the other stakeholders in the state in this process, and to give them a chance to have input and ownership of the process. And I think that's very important. So I'm the technology guy, and I'm going to try to go through some of this quickly, because one of the good things about this forum, and also the bad things, I guess, is that it stimulates a lot of thinking. And I came up, of course, listening to California, some important ideas, I think, with regard to data sharing, which is a primary concern, I'm sure, to all of us. But to start with, what's the state doing? What's different about, I think, our approach to the HIE, and in general, I think, this comes from the framework. What's the difference between, or what are we doing here? So to make this clear, our Health Information Exchange is primarily concerned, to start with sharing health information. Well, the rest of human services, is impinging on health, but isn't really health related. So what's going on? So this diagram is an attempt to talk about, or to show the kinds of things that we're trying to do. On the right-hand side, you'll see some of the major human services applications. The MMIS, by the way, for you who don't know, we are going to allow Michigan to host our MMIS. We're going to share theirs. That's now official, and I'm glad to say that. But we have all these other programs, and they have an integrated eligibility system, which we are now building. And that integrated eligibility system will be shared, of course. We already have an integrated eligibility system, but it's about 35 years old, and I think most of you can imagine what kind of shape that's in. So that's on one hand what we have on that side of the equation. On the other side, on the left-hand side, though, we have a few other things that are important for health information, not just for state agencies. Ones are MPI, which you can look at as a master patient index, but we're seeing more as a master person index. There will be ultimately over 13 million people who take advantages of healthcare services in the state of Illinois, most who are citizens of the state, but some who will be citizens of other states, and especially around the St. Louis area. That MPI is needed by everybody. It's needed by all of our framework services. It's also needed by all the health services. So we host that, and that's a shared service. Our record locator service is primarily used for the healthcare side, so I'm not going to talk about that. And then our provider directory, same thing. Yeah, we have a lot of medical providers in there, but if you take the concept of provider and generalize it as we need to, there's a lot of different kinds of providers out there. For healthcare providers, transportation, but you've also got caseworkers. You've got enormous numbers of people that are providers. We want to centralize that and make that available. So our HIE, in many ways, is really the beginning of a shared infrastructure that we want everyone to use to be efficient, as Sean points out, to try to use the financial crisis to stimulate some real efficiency in state government, which I think we're all dedicated to and believe we will accomplish. We're cloud-based. So for a lot of you, this isn't new. I'm going to go through it quickly. But why are we cloud-based? Well, it's an opportunity we can take advantage of, for one. One of the problems that Illinois has had, and I'm an ex-direct CIO of our Healthcare and Family Services, as Deneen Omer here was my predecessor. I'm not going to blame anything on Deneen. She did a great job. But we have not been, we've been laboring with an old system for a very long time, but now that we're about to make a change, we can take advantage of a lot of new technologies that were not available even 5 years ago. So one of the challenges that we're confronting is staffing challenges. Newer cloud-based, newer technologies involve a lot more skill. COBOL programming and maintaining simple servers and mainframes, it's not trivial skills, but when you look at what goes on in modern data centers and the people that are employed there, we can't really afford that labor rate to get the kinds of competence that we want. It's just beyond us. The labor costs just are prohibitive, and frankly, people with the right kinds of talents probably don't want to move down to Springfield, Illinois, to work there. That's just the fact of the matter. Huh? Speak for yourself. Speak for me, that's right. So it's a very difficult situation to deal with, and we've got to confront that. Of course, the other thing to remember here is that there's nothing in the state constitution or law that says that we actually should be providing data center services. It says we need to provide services to the state of Illinois, to the citizens. It doesn't say about who owns what those services are. So that's one thing with staffing. Secondly, cost effectiveness. Normally, when you buy your own data center, what you do is you buy hardware and software for capacity, right? And you also usually manage that capacity so that if you get up to about 50% of capacity, you start to panic. If you're in the cloud, you don't worry about that anymore. You pay for what you use. It reduces cost enormously and makes it much easier to manage things. So the other thing, of course, is if you're using cloud centers, you're sharing cost among lots of different people. If you own your own data center, then you're not sharing cost. You've got the whole thing in your hands. There's no downstroke. We didn't buy any hardware. We didn't buy any software. It's a much better situation. You pay for it. We pay for things, but we stretch things out in terms of how we use things. And then scalability is something I think people hopefully understand here. If you need more, it's available if it's in your contract, and all these other things that we've had to do with our vendor, InterSystems in this case. So we've made all of these commitments to move in this direction, and we're feeling pretty confident at this point, but that's why we're in the cloud. So I want to talk about our service model, and these are the different elements of our service model. I'm going to go through them pretty quickly. So infrastructure is primary. That is, we're seeing ourselves as an infrastructure, a solutions infrastructure. We're not an application. So some of the elements of the infrastructure which are important: security, including, of course, login and authentication. You'll see that this is going to be a critical piece as I move along. Privacy controls. We're sharing lots of different kinds of data with different types of restrictions in terms of privacy on there, so that's got to be part of the infrastructure that we offer other state services, other state agencies, let alone private enterprises, as we'll talk about. We're going to support, MMIS, SNAP, and TANF, that's to put it mildly. We actually have child support and a million other things that go along here. But we need to support that as part of our infrastructure. That's what we do. And we need to allow for unlimited growth and scaling. Why is that? Because we have no idea what's going to happen, and we don't want to make arbitrary restrictions on what happens. And then ILHI, our Health Information Exchange, is a fundamental component of this. We're going to have a lot of shared repositories. Again, the different directories we talked about. We want to partition the control of these directories among the agencies that have responsibilities. Right? We can talk about a master patient index, a master person index, but different agencies have different interests in that information. You have people who are on Medicaid, you've got that information that they're concerned about. You have people that are getting SNAP or TANF. There's all these other things that are going on. Different agencies have legal responsibilities, and we want to enable those responsibilities, not disable them. So we've got to figure out how to partition the control there. And we need to make sure that these things are done in a flexible way, because the composition of state agencies changes over time. We've seen some rather traumatic ones in Illinois, and that's part of the reason that we put this in as a requirement. We want to minimize state-built services. One of the consequences of having a lot of governors at the point in jail is that the procurement code in Illinois is rather difficult. So going out to procure new services is very difficult. So requirements can change very quickly. So one of the things we don't want to do is build a lot of things that we have to procure, because it's hard. We need to figure out some way to do this. And one, of course, is the back-end services the state needs to maintain don't change that often. We were responsible for that. But we realize that the commercial sector is the sector that can move dynamically and quickly. We want to enable that in partnership with the state. That's really an important goal. So we want to enable third-party services. It's analogous to the Apple Store or Google Play, or Microsoft's got a lot of different things like this. It's a common kind of idea right now. So we want to move away from one-size-fits-all applications. I don't want to have to do a requirements document for all the possible services that people in the state could use. One is, if you think I'm capable of doing it, you're crazy. I know I'm not. I'll be done in a second. And it's better to allow market competition to come in to take advantage of these situations. So that's what we're trying to open up. We're working with the New York eHealth Collaborative. It's about 18 states right now to start thinking about how we do that. But this is really the goal. Let's get the commercial sector in there. Let's have the state provide the infrastructure and a lot of other collateral pieces, and there's many, believe me. And that's how we think we'll be able to support all of these different services. All right. Certification and revenue sharing, that's another thing that's kind of obvious. I don't want to go into all the details, partly because it's probably not necessary in this audience, but there's a lot of things we need to think through, and we are doing that. And revenue sharing, by the way, is one of the things which I think is important, because that means instead of everything in this that we're doing being the cost center, we can start pulling information, we can start pulling some revenue in to make our enterprise more sustainable, reduce the burden on taxpayers. which is another very important thing to do in Illinois. And then our current efforts, you can see this, we've already talked about all of these things, so I don't think there's anything new here except to mention that meaningful use 2 in the health arena is a very big thing, and a lot of people are concerned about it, want those federal dollars, and we're the people that enable that. And our standards, again, I don't think I need, except maybe to mention the ATNA standards for audits, which is something we don't talk enough about, and I have a lot of ideas of how they're very valuable, especially in terms of protecting privacy and not interrupting the flow of data inside the enterprise, which is one of our concerns. And I believe that, well, our recommendations, I've made this comment before, so I'm going to leave it at there. Thank you very much.
Thank you, Sean and Kathleen and Ivan. Are there questions for Illinois? Yes, sir.
Actually realizing the value, the potential value that's created by the systems, the framework you're creating, requires the redesign of workflows and core processes within the agencies. Are you starting, did you see yourself as having a role in preparing the agencies to do that part of the work? Or is that, I'm just curious how you, I know you're in the early stages of the technology piece, but how are you thinking about, what it's going to take to actually burn this in?
Do you want me to take it?
Go ahead.
Yeah. So your question is, just to make sure that I understood it correctly, was do we see the framework project as having a role in assisting agencies in redesigning workflow and business processes to adapt to the technology that we're talking about? I think the answer is yes. Certainly on a strategic level, I think one of our core objectives is essentially to, I hate to use the word force, but to incent them to confront that reality. I could give you a long conversation about the way in which I think agencies have not dealt seriously with the question of redesign of business process as a prelude to making sure that you have technological success. I think we're extremely guilty of that. I do hope that frameworks, one of its key accomplishments is to force agencies to deal with that reality in a comprehensive way. So I think that's true on a strategic level. On a tactical level, I think that the way that we have designed our vendor resources, so we have a contract with our primary planning vendor, and there's 2 components. There's a fixed price deliverable, then there's statement of work deliverables. And so we have a rather open-ended authorization to acquire services through our vendor to do framework-related initiatives. So you can, one of the things that I think is very important is you have to have negative incentives and positive incentives. So the key problem of framework is how do you get agencies to buy in a full and faithful way and see that it is consistent with their overarching mission. There's negative incentives, i.e. the governor really wants you to do this and he'll be angry at you if you don't. We don't say it quite like that, but there's that. But there's the positive incentive of how does this actually tangibly help agencies in the conduct of their daily affairs, right? So the primary resistance of agencies is not that they're ideologically unsympathetic, it's that they see this as yet another bureaucratic imposition and yet another requirement and something else on their plate, and they don't have enough time, money, or resources to begin with. It's very much a byproduct of the problem that Ivan was talking about earlier, which is our procurement code. And it's almost funny and sadly perverse in the way that we have responded to each successive crisis by making procedural requirements more difficult. So the procurement code is a classic, some would say the paradigmatic example of doubling down on a failed paradigm on the theory that that mitigates risk. Risk of unethical behavior. I don't know that it does that. I think it changes the nature of the unethical behavior, but I think it makes it maddeningly more complicated and burdensome for our agencies. So to get back to the point, one of the things that I want to do with framework is leverage it as a vehicle to give people tangible assistance so that it is not seen as yet another level of bureaucracy. I call it the Dorothy Day approach to technology management, meaning that we give people tangible, practical assistance in the conduct of their affairs. So I hope that it's involved. I guess the other caveat would be I don't think it's going to be doing all of the business process redesign for all the agencies. I mean, I don't think it has capacity at this point, but certainly that's a key objective, and I agree with that.
Hi, Christina Bavona-Tellez from Esri. Quick question. Yesterday was mentioned that for workflow change, New York City used a lean process or Six Sigma process that they were able to expedite workflows significantly by really looking at what they do from a more of an engineering perspective. And those of us, in people services, we tend to take a long time to do something that could be done shorter if we looked at it from a process. Has Illinois looked and applied any lean processes to the workflows to help expedite and streamline? And may that be a contagious process if it has?
Yes. So this is an extremely important question, and I appreciate you raising it. And I don't want to hog this, but if you guys have a thought, you can jump in. But
Well, I'd say that the state is certainly going to leverage what our vendor is creating for us out of this planning grant. And so we will end up with workflow diagrams for every single program that's in the framework. What we do with that as a state moving forward, is up to us, but that's our goal, is to use that.
All I can say is that there's going to be a lot of opportunities. My view, and I think everyone agrees, is we're going to approach this incrementally to try to go, there's all these different programs. A lot of these workflows impinge on each other, but to try to sketch all that out, I think will put us way, way, way far behind where we want to go. So my view is it's going to be an evolving process, and as we see these things develop and we see some areas of inefficiency, we can move to make them more efficient. But to try to go and start off and make everything lean, I think is kind of a fat way to start, I guess, to put it.
I agree with what both Ivan and Kathleen said. I have a general observation, which is apart from the framework initiative, we have looked at business process reengineering and improvement in Illinois. We looked at it for the contract process, the procurement process. And I had a team at our central management services agencies do an analysis of the number of steps of approval required prior to the issuance of a competitive solicitation for technology in Illinois. So how many steps are there? In point of fact, everybody's always complaining about the procurement process. And I do this when I go to events like these. Would you care to guess how many steps prior to the issuance of a solicitation? 200. No. 8? 18. You're closer. It was 34. 34. And so I was thinking, why? How could this be? And then I read an article, which I can share with you if you'd like, from the Harvard Business Review called "The Passive-Aggressive Organization." And this is a pretty brilliant article, and they were talking about private enterprise, but what the article was about was how do organizations fall into this paradigm of behavior where everything is negative, right? And it's, conformity to a process, resistance to change, because people derive existence within the bureaucracy from having a defined role that gives them a yes or no approval. Point is that the solution to the problem of business process relates fundamentally to the method of compensation and the method of personnel management, right? So people behave this way because they have an incentive to. The way to survive in a bureaucracy is to arrange yourself in some role of indispensable authority. We have to get away from that.
I have a question over here.
Hi, I'm Nancy Thaler from the National Association of State DD Directors, and I'm actually doing work in your state. And one of the reasons I came was to hear what you had to say and hopefully meet you, because the complexity of this is astronomical. I should first say I have enormous admiration for what you're doing, for the state with the lowest bond rating and with the problems that you have to sort of leap ahead and think of enterprise in a much broader way. I mean, many states talk about enterprise as a department with multiple units, but this is really impressive and really right. So it's very complex. I'm doing work with your DD agency, a $2 billion operation, which is under a lot of litigation, a lot of court orders, and is drowning. And they've got considerable quality problems, and it's clear to me the solution is standardization of business, redesign and standardization of business practices across the board, and IT is a solution. I'm not sure they know this is going on. And so one of the things I want to do is connect with you, because I think I can help bring at least that agency, and I'm confident I can, because the leadership understands the value of IT. I just don't think they're wired into this enough. So I do want to connect with you. My question is, Illinois, like many states, is enamored of and moving in the direction of managed care. And in your big segment of your state budget, and one of the phenomenons in managed care is we lose data. No longer use MMIS for payment. Have you thought about that?
Yes, I need to probably answer that. Yes, we've thought about that, and I think this is one of the complications, because in order to actually go from MCO to ACO, we need to be able to take quality, measurements of outcomes. Right now, the only real outcome measures that we have are HEDIS measures through claims, and that's not a very fine-grained way of doing things. So it's a goal to start collecting that information. But again, this is going to be incremental. One of the things is, so tell me how we measure outcomes from the clinical record, for example. No one's defined that yet. Until we get those definitions, we can't, I can give you any data you want if you can tell me what you want. If you can't tell me what you want, I can't give you much. So, but that's going on, and I think, and that's not just in Illinois. I think the issue right now of what we really mean by quality, aside from did you do this, to what is the outcome, a lot of that also, by the way, involves public health, because it's really population reporting. So we are thinking about that. We have a thing called the public health note in Illinois. We're thinking about these things, but I can't tell you anything more than that, and we've got some interesting ideas moving forward.
And I'd like to talk a little bit about program knowledge of the framework. Really, my job is to meet with people all across the state in all of these agencies, all the division directors, all the program managers. I am not sure specifically who you're talking to, but I can assure you that at the division director level, I'm on a sales mission constantly. So I want to talk to you as well. But that really is my job in the role of the director, is to keep all these people informed.
Launch of this, having been on the other side working in a state agency that did an enterprise design system, one of the things I realized was on the program side, for people who have no experience with IT at all or systems design, the words that the technology world uses are English words, but they mean something different. And so I found myself as a program leader, just the word application took me like a month to acclimate to, because application in my world meant something very different. And so I found myself with our IT people after a while saying, when I'm shaking my head yes, don't assume I know. I think I know, but I don't necessarily know. There's really a language barrier with people. So, people talking, but the listener thinking they're hearing, but not hearing the thing you're saying. There's a real translation problem.
Our approach with the framework is that we go in and interview the business team, and then that's followed up with an IT interview of the technical side, and then eventually we bring them all together to talk about what we've found as a whole about their program. So they have input into what we find in the as-is, and then they're going to help us design the to-be as well. Sorry, go ahead.
We have time for one more question.
As a veteran of many state level and a couple of federal transformational initiatives over the last 30 years, most of which claim to be customer-centric, even though that wasn't a term that was used before the last couple of years, how do you plan to not only infuse your framework with a sense of customer centricity, but also protect it as you develop your new business processes and your outcomes of this process?
Go ahead.
It's an important question.
You just turned it off.
Okay, so It's an important question, and thank you for it. I've given a lot of thought to that. I mean, I guess there's two basic answers for how do you make sure that you're at least designing it to be customer-centric. I think one is the technology, and I think number two is the management of the planning effort. So one of the parallel projects within the umbrella of the Framework Initiative is what we call the Stakeholder Engagement Project. And I have to admit to you that when I first started working on Framework, when I became CIO, and I heard about the Stakeholder Engagement Project, it's lots of meetings with people who are providers, people who are benefit recipients. It's going around the state, really talking to average everyday citizens and thinking about, some of the questions that you were talking about. How do we make this meaningful and effective for people who are end users? And I heard about this, and it just sounded wishy-washy and silly, and I thought, well, we'll probably have to get rid of that. But I was myopic and silly, and I came to realize that the work that the stakeholder engagement people were doing was perhaps the most significant work of anything under the Framework umbrella, because it doesn't matter what you do in terms of systems development. If it doesn't have a positive impact, it isn't something that is geared towards your citizens, what's the point? So I have to admit that I was kind of embarrassed about my myopia and my Philistine attitude, and I feel a lot better about it now. But that would be one discipline to do it, and I truly believe that, because the realities that we consume our time with, internal to the bureaucracy, this department versus that department, that bureau, that's not relevant to the people who are getting the benefits and paying the bills. They do not care whether they go to the Department of Human Services or the Department of Children and Family Services. Those are incidental, right? The other side of it is, I think, technology. Ivan talked about cloud-based technology, scalable technology. One of the things we've done in the Department of Corrections is we're trying to modernize our offender tracking system, and we're using CRM software. We're actually using Microsoft's Dynamics XRM as our method of aggregating information orbitally around people. So if you have scalable technology that has a low barrier to entry in terms of cost, and if the architecture of it is to arrange information in a way that is customer specific, that could function as one of the ongoing disciplines to, as you say, protect that customer focus. I don't know that those are sufficient answers, but those are the best that we have right now.
I want to mention just one quick thing. I've been thinking about the data sharing issues, and the other protection issue that we have to confront is the privacy and security data. And I think one of the problems that we're up against, and I believe audits, by the way, are key to this, is you don't want the privacy concerns to block the data flow in the system that's supposed to serve our clients. And I think that there's many assumptions going on, especially around the electronic medical record, which are going to do just that. And maybe that's what we need to do next year. This is a very big and important conversation, because otherwise we're going to build a system which is going to be more dysfunctional than the one we have right now.